Hi there, my name is Daniel Turner, manager of the Mayor Agency, authorized agency for Blue Cross and Blue Shield of North Carolina. I really appreciate you taking a few minutes to be here with me today. And yes, it's already that time of the year again. I know Medicare can feel like a lot sometimes. There are so many plans out there, so many commercials you see, so much mail. It can get confusing. So today, let's just take a little time to slow down and talk through some of the things that really matter when it comes to your coverage. And then we'll go over some of the exciting updates for 2026. I know that over the past year, Medicare and even the political landscape around it has caused a lot of fear and uncertainty for many people. But I'm here to tell you not to worry. Blue Cross has done an incredible job at making their Medicare plans really stand out, even with tightening government regulations. Now, let's start with something that's always top of mind: doctors and hospitals. At the end of the day, that's what your plan is all about: making sure you can see the doctors you trust and go to the hospitals you need. Blue Cross continues to have the strongest network of doctors and hospitals in North Carolina. That means whether you're in Charlotte, Raleigh, or a small town in the middle of the mountains, you're going to have access to care close to home. And let's be honest, that's a big deal. While we're talking about networks, let me remind you, Blue Cross also requires no referrals to see specialists. Here's another thing that makes Blue Cross unique, and that's the famous Blue to Blue benefit, a benefit Blue Cross has had for many years. This is something no other company offers. This benefit allows Blue Cross Medicare or supplement member to switch from and to any Blue Cross Medicare or supplement plan without medical underwriting. This means no declines or rate increases because of your health status or condition. This is huge. Now, let me give you some perspective. Out of hundreds of Medicare plans across the entire country, Blue Cross Medicare plans ranked in the top 10. That's not just a nice pat on the back. That's real validation that what you've got here in North Carolina is truly one of the best options in the nation. But here's where I want to slow down for a minute, because I know you're going to see a lot of advertisements and hear a lot of big promises. Every year, companies roll out these plans with super pumped up benefits. They look shiny, they sound amazing, and they can really be tempting. But here's the thing. Many of those are the exact same companies that cut those benefits the year before. If they've done it once, they'll likely do it again. And it's not unusual to see some of these carriers show up in North Carolina, make a splash with those shiny offers, and then disappear a year or two later, leaving folks frustrated and scrambling for coverage. That's why stability matters. Blue Cross is different. We've been here for more than 90 years. This is our home. We're in all 100 counties of North Carolina. And we like to say we're North Carolinians helping North Carolinians. That's not just a slogan, it's who we are. It's why your doctors know us. It's why your hospitals work with us. It's why families like yours have trusted Blue Cross for generations. So when you're weighing all these choices, and I know it can feel overwhelming, remember this: with Blue Cross, you're not just picking a Medicare plan. You're choosing stability, you're choosing trust, and you're choosing a partner who's here for the long run. All right, with that foundation laid, let's go ahead and jump into some of the great benefits for 2026. The good news is you're still going to have access to all the great extra benefits you've been used to. For example, if you ever spend time in the hospital or a skilled nursing facility, you'll still be able to receive meals for up to 14 days after you get home. That can make recovery just a little bit easier. You'll also continue to have support for caregivers. This is really helpful for family members or loved ones who may be assisting you with day-to-day life. It can give them guidance on things like senior living options, in-home care, and even financial decisions. Your vision benefits are staying too. You'll still have covered eye exams, plus an allowance for lenses, frames, or contacts. And when it comes to hearing, True Hearing will remain our partner. That means a coverage for hearing exams and some pretty big discounts if you ever need hearing aids. Another nice benefit, each year you'll have 60 hours available for in-home support. This isn't medical care, but it can help with daily activities around the house and also give your caregivers a little extra support. Dental benefits will continue as well. That includes exams and, for most plans, comprehensive services like fillings or crowns. Just one quick note there. The only plan that doesn't include those comprehensive services is the Blue Medicare Essential plan. The Essential Plus does have them. So bottom line, if you had comprehensive dental this year, you'll keep it for 2026. You'll also still have your access to the PERS system. That's the wearable emergency response tool, and non-emergency medical rides like a ride to your doctor's appointment. And finally, let's talk fitness. In 2025, we introduced a new program called Fit On. We gave it a shot, but the feedback we heard was that it just wasn't the right fit for many of you. So for 2026, we're bringing back a trusted favorite, Silver Sneakers. I'm sure you've heard of it, or maybe know someone who has it. With Silver Sneakers, you'll have access to thousands of gyms nationwide, plus on-site fitness classes, group activities, and an online platform with live and on-demand workout videos. So really, the benefits you know and count on are sticking around, and in some cases, we're making them even better. And remember, if you're ever unsure about what applies to you, or if you just want to double check, give us a call. We've always got agents ready to help. The Blue Flex Card. This was a new benefit for 2025, and it will continue for next year. Now, if you're already using this card, you know how simple it makes things. For 2026, you'll still be able to use the same card, and it's preloaded with multiple allowances that all come together on one debit card. First, it includes your over-the-counter allowance. That means you can use the card at local pharmacies or through the online OTC catalog to pick up everyday health items you might need. Second, it also works for your vision benefits. This is great because you're not locked into one store or provider. You have the freedom to purchase lenses, frames, or contacts wherever works best for you. And lastly, here's a little bonus. When you complete your regular routine exams and tests, you can actually earn reward dollars. Those dollars get loaded right onto your Flex card automatically, and you can use them at select stores. It's a nice way of being rewarded for simply taking care of your health. So bottom line, the Blue Flex card is staying for 2026, and it's still going to be that all-in-one, easy-to-use card that gives you flexibility and freedom with your benefits. Here's the website associated with the Blue Flex card if you would like to read more about it. Now, let's take a look at the updates for the Blue Medicare PPO Enhanced Plan. On the screen, you'll want to locate your county and the associated segment number over to the left. This is how you'll know which benefits apply specifically to you. Once you know your segment, go ahead and apply it for the next slide to see your benefits for 2026. I also want to point out something important about the annual maximum out-of-pocket. This is not a deductible, and it's not the amount you would automatically spend if you went into the hospital. Think of it as your safety net. Here's what I mean. If you ever had a really challenging medical year with multiple hospital stays and surgeries, this is the most you could owe in a given year. Once you reach that number, you're done paying for the claims for the rest of the year. Blue Cross then picks up 100% of your medical cost for the remainder of that year. So it's really there for peace of mind, protection in case the unexpected happens. The next slide continues to show your benefits for 2026, and it also highlights some of your additional benefits, like dental and vision coverage. I'll pause here for just a moment so you can take a look at your plan and see how these benefits apply to you. As you review this, keep in mind your segment numbers from earlier. That's the key to knowing which specific benefits apply to you. This will help you see exactly what's included in your plan and how you can make the most of your coverage. The next slide is just a reminder of how great the PPO network is. With North Carolina, you have access to over 60,000 providers, so no matter where you are in the state, there are plenty of doctors and hospitals available to you. Here's the really great part about your plan. You also have what's called the Traveler Program. This allows you to use doctors and hospitals in other states and receive the same benefits you would if you were here in North Carolina. This is a fantastic option for anyone who travels frequently or spends a lot of time outside the state. If you'd like to learn more, the website is listed at the bottom of the slide. You can visit at any time to get additional details about the Travelers Program and how it works. And that wraps up our overview of the Blue Cross Medicare plans and the benefits you'll continue to enjoy for 2026. Remember, if at any point you're unsure about which plan you have, or if you've ever seen another plan in this video or somewhere else that you think might be a better fit for you, please reach out to us. This is exactly what the annual enrollment period is for, making sure you have the best coverage that works for you. Our agents are always ready to answer your questions and guide you through your options. Also, a quick word of caution. During this time of year, you may receive calls, mail, or advertisements encouraging you to switch plans. Many of these are trying to promote something new or flashy, and they may not always be in your best interest. Before making any changes, we strongly encourage you to speak with us first. That way, you can be sure you're making the decision that's right for you in your health coverage. Thank you so much for taking the time to watch this video. We hope it helps you feel more confident and informed about your plan and benefits available to you. And again, if you have any questions at all, please don't hesitate to give us a call. We're here to help.